Hello, and welcome to the Physical Therapy Owners Club podcast. I'm your host, Nathan Shields. And today I've got a return guest, Vikram Sethuraman. I hope I said it right this time, Vikram.
Nailed it perfectly.
Awesome. He's the CEO of PT Wired and coming to us from Spain, which is pretty awesome. I'm impressed. He's working remotely. Hey, Vikram, thanks for joining us again. We had you on 3 years ago. It's cool to have you back and catch up with you and see what you guys are doing nowadays. For those who, of course, might not have been listening 3 years ago and might be listening to this for the first time, tell us a little bit about you and where you're coming from.
Thanks so much again for having me back on. I had a lot of fun last time. I'm excited for this time. Yeah, I am the CEO of PT Wired. PT Wired is a patient engagement and RTM solution for physical therapy clinics. What we offer is basically a branded application. So every clinic has their own custom branded app, their clinic name, their clinic logo, color scheme, etc., on the App Store and Google Play Store. And then that app is basically intended to be the full service patient engagement experience for the patient. So they get their home exercises, they can message the provider, they can track their progress, they have gamification, achievements, awards, appointments, bill pay, all that stuff. And then on the therapist side, they can track everything for RTM automatically through our dashboard. So then they can generate a new stream of revenue from RTM.
So PT Wired's not the only player in this space, right? I mean, if you go to the PPS convention or CSM, I know you're at PPS. I don't know if you go to CSM, but you'll see a number of those. And of course, I think the difficulty with many physical therapists is they don't like to change their way of doing things. When you try to implement new things, hey, this is better for the business or this is better for the patient. Man, if it's going to make me do some extra clicks and change my flow,
Right.
I'm not that interested. But we do have to recognize that there is a benefit to these for the technology, the digitization, if you will, of some of these things. What are some of the issues that owners are still bringing up that keep them from doing some kind of digital home exercise program application, which is, and I know that's only a small portion of what you guys provide, but what keeps them from moving away from the stock photos of cards that they put on the copier machine to do home exercise program? What's keeping them from switching over?
We've been at this a long time now, 7 years we've been in this space, and it's been interesting seeing how the answer to that question has changed just over the course of the time that we've been around. There are a couple of things. I think earlier on, we would get a lot more concerns about the older populations that are typically the people going to physical therapy being those populations that would engage with digital devices for this purpose. Even back in 7 years ago, that trend was already starting to occur, but it's even more so the case now. Nowadays, 83% of people above in 50 to the age range 50 to 64 have a smartphone device, engage with it every day. That's 61% for people 65 and older, and that's continuing to go up over the years. And then as far as just computer and internet access generally, it's 96% for 50 to 64-year-olds and 75% for 65 plus. So, used to be more of a question people asked. I think most people nowadays are, everybody has maybe a grandparent or parent that has, a device. So I think that's a bit less of a concern. Nowadays, what we're seeing is, PTs are busy, clinic owners are busy, and if it's not broke, they'll fix it. People have been doing their cards, they have their papers, they've been doing that for a long time, and any change, even if it's something that will ultimately be more efficient down the road, initially it's gonna, there'll be a learning curve. Knowing that people are so busy already, and also up until there were other reasons to make the switch, like RTM, there was less of the incentive on their side to do it because, they have a system that works and that's comfortable. And there's a million other things on the to-do list. So that's what we've seen.
You talk about patient engagement, but what are some of the benefits to the therapists and to the owners for having this kind of system in place? It makes it easier for patients to access their home exercise program. But like, for example, the first thing that went off in my mind is, okay, if you can do some bill pay through the app, that's pretty awesome. Helping with billing and collections, there's got to be a return on that. the little things like that. What are some of the things like that that you recognize that are really helpful that are make this a benefit to not just the patients, but the patients, the therapists, and the owners?
Yeah, ultimately, the main stat that we want to focus on, because it's the most, the easiest one for everybody, is revenue. And, when you're not engaging patients, there's a lot of ways that leads to a loss of revenue. The primary one being patient dropout. And when patients aren't engaged in between visits, that's the number one time when they drop out, is when they're, for example, failing to adhere to their home exercise program at home. They're at home and they have less support, they have less motivation, and then or less instruction, or they don't have the reminders they need, or the proper instruction by medium, whether it's a video versus an image or a text, something written on a piece of paper. And that is what leads to the dropout rates that we see. And 70% of patients don't finish their course of care. 20% drop out in the first 3 visits. One survey more recently found that retention was as low as 7% in practices with more than one physical therapist. And a small bump to that retention number can have a big increase in profit. So that's kind of, I think, a good starting point. And as far as what we can do to tweak that, going back to kind of the old methods of paper and postcards and things with the exercises, a while ago, clinic owners really didn't have much that they could do to impact that.
That's true.
They could
There's
do
phone calls and maybe some texts and stuff like that.
exactly. Yeah, and that was pretty much the extent of it. And again, previously those phone calls and text messages weren't billable time, so that's another barrier to that. Nowadays, we have everybody's got this smartphone in their pocket, and we have access to the patient in between visits much more than we did in the past. And that's not only for something like home exercise programs, that's for something like sending a message, that's for something like making it super easy where they can just go on the app to book their next appointment versus having to call to the clinic or the clinic call them to get that scheduled. And like you mentioned with bill pay, making everything a lot easier. And then also in between these visits, collecting data on what the patient is engaging with so we can detect dropout earlier before it happens. So I think that's kind of the biggest thing with this switch to digital patient engagement, is that there's much more power in the hands of the providers, because they have access to the patient in between visits in a way where they never did in the past.
Out of curiosity, does PT Wired and some of the other apps, do they usually collect some statistics in terms of the patient is doing the exercise this many times a day, or they are do they have some kind of compliance statistics and that kind of stuff that are easily pushed to you, or you can easily go to a dashboard?
Yeah, so we certainly do. I think most digital HCPs do, and that's going to be a big help, is having a very clear picture of what patients are doing. And if you look at the factors that actually affect behavioral change for patients, accountability is the number one thing. So not only is it beneficial to the provider to be able to see what the patient's doing, it's beneficial to the patient, because then that's the number one thing that will impact their level of engagement, is knowing that the provider, can keep tabs on them. It goes both ways.
This might be from left field, but do you see how or if AI is going to affect, or are you leveraging some AI at this point, or looking for ways to do that? I mean, that's kind of the hot topic right now, is how AI is going to affect so many things, but it could definitely affect healthcare as well. And so are you noticing anything where it might be affecting you?
Oh yeah. No, AI, the biggest buzzword of the day. So the way that we use it, I think the applications of it in this digital patient engagement space is really endless. But the ways that we're using it currently is, like I said, we've been around for 7 years. We've had hundreds of thousands of patients use the system and their full plan of care and all that. So we have a lot of data on levels of engagement of patients and then the outcomes of that patient. So the way that we're looking at it is, what can we see in terms of behavior on the app that's indicative of different outcomes, whether it's a dropout, a successful discharge, an instance where a patient has very high percentage of RTM eligibility for billing based on their engagement, or a situation where a patient has very low percentage of RTM engagement. So then the earlier we can detect that based on the data, then the more effectively we can intervene earlier and adjust, make the adjustments that we need to get them on the right track. That's how we do it on the patient side. On the provider side, with the exercise search, we have 7,000 exercises in our library to pick from. You can add your own, but that's what we provide, and that's a lot. And people still want more. They always will want more. But one thing we can do there is just create a more effective search system to then give people the results which are more relevant to them based on what we've learned over time. So then it gets progressively better and more useful to the provider.
Oh, that's cool. That's cool. So tell me a little bit about RTM, remote therapeutic monitoring, if people don't know about it. Done a couple of episodes recently in the past 6 to 8 months. So look in the podcast library to learn about RTM if you don't know about it. But it's been out, what about, did it come out January 2022 or 21?
Yeah.
Something like that?
22. Yeah, 2022.
Yeah, so it's just a little over a year old. And so some therapists might still be getting used to it. Maybe they've heard the word, but they know nothing about it. What can you share about RTM? Because you've made it easier with the implementation of RTM opportunities within your app. Tell us a little bit about it from there.
Sure. So that was another barrier in the past for people making the switch to digital, is the cost element of going digital versus going paper. Obviously, it's going to be more expensive to go digital. And then now a new way that can be addressed is through RTM. It's not only going to help you cover the cost, it'll help you view it as more of an investment than a cost in the first place, because you're actually getting a return on the investment that, well exceeds the cost.
Right.
RTM, some of the things we just talked about in terms of patient engagement and patient retention and how that impacts outcomes and the bottom line of the clinic. That's really why RTM exists, is because data from these types of digital platforms being used with patients was really indicative of the fact that it leads to better outcomes, it leads to better retention, it leads to less need for a surgery or medication, and instead the successful result in physical therapy. And that's why these codes were brought into existence, because it adds extra incentive for clinics to use these types of systems and engage with patients more in between visits, because that's what's going to lead to successful outcomes. So RTM, there are 4 codes. The way I try and break it down in the simplest terms is there are codes that are based on the patient's level of engagement with the system that you're using, for example, with our app or whatever system you may be using. And then there are codes for the provider's time, that the provider is monitoring the patient, engaging with the patient, setting up the patient's care plans, editing the care plans, etc. We talked about how in the past, the only thing that a provider could do would be shoot a call or a text to a patient if they didn't have like a digital system, and then how that time wasn't billable in the past, but now that time is billable through RTM if it's done as part of one of
Yes, you can document it. Yeah, to share what you actually discussed.
Exactly. Yeah, so that's kind of a high level quick summary, and yeah, like I think you mentioned, a lot of people are a bit more familiar now. I think for all of 2022, people were kind of, feeling it out and seeing a lot of people were waiting to see what, I guess, both other people did as well as kind of what happened with RTM, because it was the first year. Now it's been getting a bit more mainstream, I would say. I think a lot more people are adopting it, or at least planning to adopt it. And I think in part that's because, last year CMS proposed a couple changes and then they didn't actually get implemented in the final rule. So then I think people have a bit more confidence that RTM is here to stay. So if they make the investment into implementing an RTM strategy at their clinic, then it is going to be worth it in the long run.
So if people are looking into taking advantage of RTM and they don't know where to start, maybe they're looking for some kind of software support, digital support, some kind of app that would guide them, what would you recommend they look for in an app or software to help them be able to do it, especially if they're starting from scratch?
Yeah. the RTM codes, the billing requirements are pretty complicated at face value. So you've got some codes that are billed per 30-day period, some codes that are billed per calendar month, some codes that require data transmissions, some codes that require time tracking. So it gets really complicated really quickly. And I think the number one thing is you would want to find a system that does all of the tracking for you and basically computing the billing side of things in terms of when a patient's met the requirements for billing a code. You want something that'll do all of that for you. Um, I mean, you can track it yourself. That is possible, but at that point, it gets to like how much are you really getting in terms of the time you're spending in it. The ROI gets a bit more dicey there. So I would say that's the number one thing. For example, on our end, we have a smart timer that tracks time based on what you're doing. If it's RTM eligible, we'll count it based on the requirements. And then once you meet the code requirements, you'll get a notification that a patient has met the requirements, and we'll give you the code, we'll give you the supporting documentation, et cetera.
Nice.
Yeah. Another thing is that the billing is a bit complicated for this, just because these codes are meant to be billed outside of visits, and a lot of the EMR systems out there currently don't allow for that.
Right.
So having a system that assists with that and makes, for example, getting the supporting documentation very simple, getting a timely notification, and also assisting in the whole billing side. Because, for example, I mentioned some of the codes are billed per calendar month. If it's getting towards the end of May here. If we had a code that was eligible to be billed at the end of the month, but then you don't bill it until June, and then you try to bill the June code in June month, you could run into issues there. So it can get pretty complicated. So you want a system that will help you with that side too.
I got you. So it's one of those that'll give you the bumper guards like in bowling, like, okay, hey, you can't do that, you can do this, and here's the documentation that you just need to cut and paste into your EMR software for the appropriate documentation of it. And it says, oh, you haven't met that yet, or hey, you have met it. This is the code that you can use. So it sounds like what you're looking for in any kind of support, but what you guys also provide is those kind of guardrails to keep you compliant and also tell you when you've met, and also seems to be teaching you when you can use those codes and when not.
Yeah, and I think that's another part there too in itself is the initial training. You want a system or a system where they'll help get you up to speed at the beginning and give you the training, whether it's just on RTM generally, RTM strategy. One thing that we do is we'll have a kickoff call where we have questions for the clinic to then make recommendations on different strategies they can implement based on how they already do things. And the last thing I would add there is, I mentioned notifications when a patient's eligible for billing. That's at the end of the billing period, whether it's a calendar month or 30-day period. What you also will want is something that in the middle of the billing period tells you kind of how you're progressing towards the code to meeting the code. And then you can, prioritize your time. For example, if you see these patients are on track, like they're going to meet the code requirement for 98977, and I don't really have to do much more engaging to get them to use the app more. Like they're pretty much good to go. But these ones, they're on the fence. So if I have 15 minutes in between a patient visit to do some RTM, I want to focus on these ones to really get the most, really optimize my time and get the most revenue from RTM.
Gotcha. And I don't recall, I had the interview with Matt Jurek about RTM a few months ago, like I said, and I don't recall, are there payers outside of Medicare that are reimbursing for RTM codes?
There are. It's complicated though, because basically, we've heard of over 30 payers that are reimbursing, but it depends on the state. It depends on the plan. And, the kind of lawyer answer I always give is you got to try it. You got to verify with your payers in your area. And unfortunately, it is like that. And there are instances of payers who haven't kind of released anything stating that they are reimbursing, but then they actually are. We are seeing payments from them. So yeah, I think it's definitely worth looking into, especially if you're, Medicare isn't the massive, or if you have a big non-Medicare patient population, it's definitely worth seeing payers that are now reimbursing.
So the if all payers were paying for RTM, then it's probably something that should be part of the routine for almost every patient, wouldn't you say?
Yeah, and I mean, we have a lot of, so for us, like I mentioned, we have the patient engagement app, and um, for all clinics that use our system for RTM, they use the app for all their patients, whether they're RTM eligible patients or not.
Right.
That doesn't necessarily mean that they do the extra like phone call and 20 minutes of time per calendar month for the patients that are non RTM.
Okay.
But they'll still set the patient up on the app and have a lot of the same engagement that they would with an RTM patient. Because again, the idea here isn't that the idea here is related to the other stats that we talked about earlier in terms of patient dropout and outcomes. That's what it's really about.
Right.
for Medicare. That's why Medicare, approved these codes, is they saw the value there.
Right. I got you. And so, what have you found has been the most successful strategy for implementing RTM? Well, let's start with before RTM. What's the most important strategy to make this a successful transition from whatever the system was before for patient engagement to a digital app like this? And then after that, what's been successful for implementation of an RTM program as well? But let's start with the first one. If they're going from, hey, okay, yeah, I did my paper copies on the copier. Now hey, everybody, we're switching all over to this digital app. What has been some of the most successful actions to make sure that happens?
Yeah, definitely the most important is the provider adoption at the beginning. Obviously, if the providers aren't using it, then the patients won't ever get set up to use it. The biggest thing that we found that's indicative of a successful implementation are the providers having the initial setup on their end of templates and favorites for their exercises. So like with the paper printouts that you just mentioned, a lot of people that have that, they have like a hip printout that they use for a lot of their, hip replacement patients or something.
Right.
So getting that same like template type thing that they're just know and they used to, they know and that they're used to it into the digital system as a template with the videos that are associated with the exercises, et cetera. And, exercises, everybody has their same 15, 20 exercises that they use a lot more than another provider necessarily, having those flagged in the system. So those are always the first ones popping up. That's actually when we track implementation at the beginning to ensure that things are going well. We're looking at every provider's favorites and templates, and then we're flagging the people that don't have any, and then we're kind of trying to engage with them to say like, hey, how can we help you here? We should, because we just know how much easier it is and how that's indicative of a successful implementation.
Sure, I can see exactly what you're talking about because we used to have file folders right next to the documentation station. And there was the hand, there was the shoulder, there was the knee and the hip file folder, and they had the printouts for us, so we could always just grab that and hand it to the patient, and it made it super simple. And so you've got to make it as simple as that for the providers.
Definitely.
Gotcha. And so, do you also have? Do you recognize that the owners who are engaging with the providers prior to landing on the app that they choose have a little bit more success? Because I'm just assuming if an owner just comes in and says, hey, we're going to switch over to this app, here we go, and they're blindsided and it's a kind of a surprise, that I'd assume that's not best for successful implementation. If you get the providers engaged, on the other hand, there might be some buy-in earlier on.
Yeah, and definitely true. It depends some on the clinic and the therapist population. If they're younger therapists, definitely I think it's pretty easy to implement. I think they are kind of more ready to use a new tech system like that. Right. I think the biggest thing is so getting the therapist buy-in. We have we do demos for everybody as if they're looking at implementing our system. And what some people will do is they'll bring some therapists on, some clinic owners will bring therapists on the demo and get their take of how it will work for them. And I think the biggest thing that we always focus on is the time spent that the therapist would have to engage with the system, because you've got your file cabinet with the wrist PDFs, and it's how much time does it take start the stopwatch to reach in, grab one, and hand it to the patient? It's
Right.
not much. So that's kind of what you're competing with. If that's the system they're using, it has to be approached from that way to then say, okay, can I just open up PT Wired, hit wrist, and then hit send, and then in the same amount of time, now the patient has an engaging app with videos and reminders and gamification, and appointment scheduling, bill pay, and all these things that in the same amount of time that it would have taken me to give them the piece of paper.
Right.
Obviously, like I said, we need to have the templates and the favorites to get us there, just like you had to have the file cabinet prepped over a lot of time so that it got to be that easy and quick. But yeah, you have to have the therapist buy-in for it to be a successful implementation.
Gotcha. And so then the same question for RTM for those who haven't used it. Maybe they're already using PT Wired at this point, but then implementing RTM. What have you found that clinics are doing to make that a successful implementation as well?
There's a couple different approaches to RTM. And what we've seen some groups do is they have a dedicated RTM provider. So it might be one PT or PTA who is the RTM provider for, like, let's take an example here. Let's say it's like a two location practice, 8 PTs, and you have one PT who is the RTM PT for that practice.
Okay.
That PT will do the check-in calls, the interactive communication that's needed for 98980 and 98981 for all of the patients in the clinic, not just the ones that they're seeing. Yeah. The advantages to that is that then only one person needs to know the ins and outs of RTM. And then, because we've seen this work in some clinics, and we've seen the everybody for themselves work in some clinics. This is why I mentioned earlier, one of the things we do is on our calls, we have discussions with the clinic, ask them some questions to kind of make a recommendation based on how they do things, and also kind of give the pros and cons of each approach. But another thing that works really well with strategy, so if you have a dedicated RTM provider, you can kind of even block out time for them to do the RTM. And one creative way we've seen people do this is, say you have somebody who's on maternity leave and they want to spend an extra day or two at home after they come back, but then they still want to get hours in. They can do RTM. They can be the dedicated RTM provider. We've seen that implemented a lot. But another thing is, everybody has cancellations, and in the past, cancellations have been, lost revenue. You have an hour block that you were going to be billing codes, and now you're not. And what a lot of people are doing with us is they're using that as an opportunity to do RTM. So if you have a cancellation, you can do maybe 30, 40 minutes of RTM during that hour slot. Okay. And that could be for your patients. That could be for other patients in the practice, for maybe a provider who doesn't have many cancellations this week. So that way everybody can kind of hit the RTM requirements. And one more thing I'll mention is it's very important how you position it to the patient. What we found is that you really want to position the app as a monitoring tool versus an instructional tool. I mentioned that some of the codes are built based on the patient's level of engagement. So if the patient engages more, then you hit the requirements more and you can build a code more. But what we found is if you position it as purely an instructional tool, we have videos for the exercises. Patient might need to watch the videos the first 3-4 days. And then if they have the same HCP, they might not need to on the 5th day because they now have learned the exercise. If they view it as an instructional tool, they might not open up the app and mark it as complete. If they view it as a monitoring tool and they know that somebody's checking in on them and really looking at how they're engaging, then they'll still take that extra step, which is what we need to build RTM. Okay. Yeah. So that's another thing we'll chat with on our implementation and onboarding calls is small things you can do from how you position the app with different language that you can use to get the best outcomes with RTM.
Yeah, I can definitely see as being a PT owner in a place where there was definite seasonality. You can see where during the slower seasons, pushing RTM, instead of sending people home early, maybe make a few calls for us. One question I had, because you said PTs or PTAs could do it, with Medicare making the 15% cuts to PTAs, Does that take place with RTM as well? If a PTA made the calls, do you know if it'd be decreased in the reimbursement rate if a PTA did it versus a PT?
Yeah, so it does for some codes. So there are 4 codes with for RTM.
Okay.
98977, which is the data transmission code on the 30-day billing period, that is not subject to the de minimis standard, that reduction. The other codes are if more than 10% is completed by the PTA.
Oh, okay. Gotcha. Interesting. Okay. But I'm thinking about that from a PT owner mindset of, well, I love the idea of having a single provider making some of those calls. They kind of become the specialist, if you will, right? And they could also be the person that heads out and trains the other people on RTM stuff, even though they're doing it most of the time, because you always want to have some kind of backup, right?
Yeah,
So
yeah.
I like that idea of just having someone lead out on the program. And do you have someone like that? Do you recommend someone like that also simply for going to the digital HEP app, that maybe there is a provider that's not the owner, that is the lead person to get this pushed and implemented into the programs? Have you seen success with that?
Definitely, and it's mainly at bigger organizations, so like 5+ location clinics. The bigger you get, the more we found it's helpful to have like an internal champion, essentially,
Right.
who because we've also found that as clinics get very big, then there gets to a point where providers at the clinic, there's a subgroup of providers who will ask a question to somebody internally, but they wouldn't send it to us, for example. So it is kind of helpful to have like a internal expert who then works a bit more with us, gets really, really up to speed, whether it's on RTM or just general patient engagement at HEP, to then help make sure that clinic is really working well.
Yeah, I can see that as being an opportunity for PT owner, and this is just conjecture, but um, if it wasn't the clinic director that's going to champion the digital HEP program or RTM program, maybe there is someone else within the group that wants to take on some kind of leadership role in the future in a clinic, and this could be an easy way for them to develop and show leadership skills and put them on the path to leadership training. If they were to head this up and become the specialist and make sure everyone does it and follow the dashboard and keep the KPIs and all that kind of stuff, it could be a great opportunity for them.
Yeah, and the approach that we talked about like hiring that one person, for some clinics, if you're big enough, they can be a full-time thing. And we have had that happen. We have multiple clinics that we work with where they just have a single dedicated RTM provider for everybody who's full-time RTM. And we even have the model, what we call the full service model, where on our end, PT Wired, we employ providers and then they can help the clinics fulfill those requirements as well. So again, that's something we always chat about on a call is what type of system, what type of RTM approach will make the most sense. And, for example, if it's a group that has a higher cancellation rate, or they just brought on a new PT, so they're not fully booked out on their schedule, that probably makes more sense to manage it themselves. Whereas if it's a group that's fully slammed and, 5 locations and, wait list, all that stuff, you probably might want to hire a full-time dedicated RTM provider to take advantage of all of the revenue for all of the patients that are already coming in. So yeah, there's a lot to it.
Interesting. Cool. Well, if people have more questions, how can they get in touch with you and ask you about digital HEPs and RTMs and how they can work with their clinics?
Sure. You could go to our website, www.ptwired, so PTWIRED.com. We have a lot of information just on RTM generally there, as well as if you want to book a time to chat with us, you can. We're happy to be a resource on this, whether you decide to implement with us or you have another system you want to implement. We're happy to be a resource in terms of making strategic recommendations or answering questions on RTM. So yeah, that's where you can find more information and go from there.
That's great. Well, cool. Hey, it's been 3 years. I guess we need to follow up again, and maybe not 3 years from now, but maybe in a couple of years, and see what's happening with PT Wired then, right?
Yeah, hopefully, and definitely we'll have a coffee at PPS this year.
Awesome. Cool. Thanks for coming back and joining me again, Vikram. I appreciate it.
Yeah. Thanks, Nathan.